Every Monday, we like to find new ways to get healthy. Joining us today is Abby Wilson with Portneuf Medical Center Diabetes Team. November is Diabetes Awareness Month. Let's talk a little bit about what diabetes is. Diabetes is the body's ability to not do what?
Basically use the fuel from your food.
Okay.
So it's with the buildup of sugar in your bloodstream, or glucose is the other word we use for it.
And the body just doesn't know what to do with it. And so it doesn't know how to get rid of it. And so what happens when you have peak high sugar glucose ratings?
Yeah, so some symptoms people might experience are increased thirst, increased urination, maybe blurry vision. For some folks, even a rapid amount of weight loss.
Okay, and there's long-term effects to this too.
Yeah.
When it turns into diabetes type 2, what could happen there?
Yeah, so when blood sugars stay high, and if you have type 2 diabetes, it can hurt your eyes, your kidneys, your heart, essentially causing damage from the inflammation there. And so if we can get into a provider and get it under control, then we can live a really healthy life.
What's the difference between type 1 and type 2?
A great question. They often get confused, and either one can happen at any stage of life.
Okay.
So type 2 is when your body can't use insulin very well and may also not make as much as it used to. And type 1 is when you have an autoimmune disorder that shuts down all of your insulin production, and you have to have insulin no matter what.
Now, there is good news for people who are diagnosed with either prediabetes or type 2 diabetes, because it can be manageable and it can be reversed in some cases.
Absolutely. So with diabetes self-management training and education, as well as good changes in your dietary habits, so though your nutrition and movement, we can do a lot to have a really healthy life and potentially put it in remission.
Oh, very nice. And so people, who are diagnosed, realize what they have to do. They get into some training, they get a doctor's advice. But there's a lot of people who don't realize they're either on that path to prediabetes or type 2 diabetes.
Right.
A lot of people out there.
There are. In fact, just globally, 1 in 10 people have diabetes, and 1 in 4 don't know that they have it or are on their way.
Okay.
So it's important to get in with your primary care provider at least once a year to get screened for it.
Now, Portneuf Medical Center, you've got classes, you've got things you can do to learn more about this. Where can they find information?
Yeah, so we have a great primary care team up at Portneuf Primary Care at Northgate and specialized family medicine. And then we have our diabetes self-management team, and you can reach us, the training team, at 208-239-2070, and we can help you get connected with a referral.
Oh, fantastic. Abby, thank you so much for joining us today.
Thanks for having me.
Very important topic. Now,